Hello, guys. Welcome to a series, a podcast where we discuss everything in care. I thank you for subscribing to my channel. And if this is your first time, kindly click the subscribe button below so you can be notified when I upload interesting episodes. I remain your host, Tony Clement. Today, we're going to be discussing the topic virtual healthcare, a new era of medicine.
This
Virtual
podcast is sponsored and brought to you by HealthShare Integrated Solutions.
Virtual healthcare, also known as telehealth or telemedicine, are seeing unprecedented growth in years. With advances in technology, the increasing adoption of digital health tools and impact of global health events like COVID-19 pandemic, virtual healthcare is rapidly transforming how patients access and receive care. In this episode, I'll be sharing with you how and why virtual healthcare is exploding. Number one is acceleration due to COVID-19 pandemic. The pandemic acted as a catalyst for the expansion of virtual healthcare as in-person visits to hospitals and clinics were restricted. Patients and healthcare providers quickly turned to virtual solutions to ensure continuity of care. Telehealth services experienced exponential growth as a safe and convenient alternative to face consultation. Adoption by healthcare providers. Many healthcare providers, from general practitioners to specialists, embrace virtual consultations, realizing the benefits of telemedicine for routine care, chronic disease management, mental health, and even urgent care. Number two is the technological advancement. The widespread availability of high-speed internet, along with mobile technologies, has made virtual care more accessible than ever. Patients can now consult with healthcare providers from their smartphones, tablets, or computers, reducing barriers to access to health care. AI and wearables, advances in AI-powered digital tools, remote patient monitoring, and wearable health devices have further enhanced the ability of virtual care. These technologies allow healthcare professionals to track patient virtuals, detect abnormalities, and provide real-time feedback from a distance. Secure communication platform is another way by which developments in secure telehealth platforms equipped with encrypted video conferencing and messaging have made it possible to deliver confidential and HIPAA complaint virtual healthcare. Number three is increased access to care. Virtual healthcare is helping bridge the gap in healthcare access for people living in remote or on underserved areas, patients in rural locations who may have limited access to specialists or healthcare facilities can now receive medical advice, consultation, and prescriptions without need for long distance travel. Virtual healthcare has the potential to connect patients with healthcare providers across the globe, allowing for second opinions, specialized consultations, and medical tourism without the need for travel. Number four is convenience for patients. Virtual healthcare offers unparalleled convenience for patients by eliminating the need to travel to clinics, wait in long lines, or take time off work. Patients can schedule appointments at times convenient and receive care from the comfort of their own home. Reduced wait times is another advantage, as telemedicine often leads to shorter wait times for consultations, patients to quickly access healthcare professionals, and many minor health issues can be resolved efficiently through virtual visits. Number five is chronic disease management. Believe it or not, virtual healthcare is particularly effective for managing chronic diseases such as diabetes, hypertension, and heart diseases. Remote monitoring devices such as blood glucose meters, heart rate monitors, and blood pressure cuffs allow healthcare providers to continuously track patient health and intervene when necessary. Telemedicine for follow-up care is also another way by which it's been applied, and it helps with regular checkups and medication adjustments, which are very vital. Virtual healthcare enables more frequent touch points between patients and providers, leading to better management of long-term conditions. Number six is mental health services. Virtual healthcare has led to significant expansion of mental health services, including telepathy, telepsychiatry. Patients can now access mental health support from licensed professionals via video calls, chats, or even text-based therapy apps. Many patients find it easier, more comfortable to engage in mental health services from home, which has contributed to the growth of virtual mental health platforms. Cost efficiency. Virtual healthcare is often more affordable than in-person visits, as there are fewer overhead costs related to clinic space, staff, and equipment. Patients also save money on travel, childcare, and time off work. Remote monitoring and timely virtual consultations can help reduce hospital readmissions. Take two. Remote monitoring and timely virtual consultations can help reduce hospital readmissions by catching potential complications early and allowing for prompt interventions. So this help to better lower the cost of patient care over time. Number 8, integration with health systems. Many health systems are integrating virtual care into their broader services. Virtual consultations are now being used in conjunction with traditional in-person care, forming a hybrid that enhances patient outcomes and optimizes healthcare delivery. Virtual triage systems are increasingly being integrated into emergency services, EMR, where patients can receive initial evaluations from healthcare providers before deciding if in-person emergency care is actually necessary. Number 9 is government and insurance support. Many governments, including Nigeria, have updated regulations to support the expansion of virtual care. For example, during COVID-19 pandemic, many countries relaxed licensing requirements, allowing doctors to provide virtual care across states and national borders. Insurance companies and public health systems have also started recognizing the value of virtual care by offering reimbursement for telehealth visits. This has incentivized both health providers and patients to adopt virtual health solutions. Challenges to overcome when it comes to virtual care. Number 1 is digital divide. Number 2 is quality of care concerns, and then number 3 is data privacy. In conclusion, virtual care is recognizing the way care is delivered, offering a convenient, cost-effective, and accessible alternative to traditional in-person visits. As technology continues to advance, healthcare systems adopt to these changes, virtual care is likely to become an integral part of the global healthcare landscape. The future of medicine will likely be a hybrid model that combines both virtual and in-person care, improving patient outcomes and transforming healthcare delivery for millions of people around the world. That's all we have for today. Thank you for tuning in to Health Series. We hope you found today's episode insightful and valuable. If you enjoyed the conversation, don't forget to subscribe, rate, leave us a review. It helps us to reach more listeners like you. Be sure to follow us on Facebook, Instagram, and TikTok for updates and to join our growing community of Health Series. If you have any questions, topics, or you like us to cover, or guests you love us to invite to the program, feel free to reach us to us. We would love to hear from you. Until next time, stay informed, stay healthy, and keep exploring the world of healthcare with us. Thanks for listening.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.